Thank you. It is great to be here. Thank you, Adrian. Thank you, Dr. Shukat. It's great. It's just great and humbling and an honor to be here. I'm so excited to share the Flint story, but really to share the light that Flint has cast across this nation in regards to our unfinished work regarding lead elimination. And this is work that we must all do to protect the promise of all of our nation's children. And I want to start by introducing you to one kid. This is Lily. She's one of our beautiful Flint kids. And it wasn't too long ago that she came into clinic for a 6-month checkup. And it is my privilege as a pediatrician to make sure that Lily is healthy today. But more importantly, my work as a pediatrician is critical to make sure that she has the healthiest and brightest future possible. My work, just like your work, is nestled in prevention and really in the potential of our children. But in Flint, for Lily and for thousands of other kids, there was something happening in our city that really was threatening all of their tomorrows. And we'll get to that. But before we go into kind of what happened in Flint, I want to share with you, and hopefully you all know that Flint was not always synonymous with disaster. Flint was the birthplace of cars, of General Motors. Flint was one of the country's greatest industrial cities, a promised land in the Great Migration North and for immigrants all over the world. And even more than that, Flint was the birthplace of the middle class, thanks to organizing and labor and contracts, which brought prosperity and opportunity in the form of living wages, healthcare, housing, great schools, infrastructure, and even great benefits. And it's hard to believe, but at one point, the people of Flint had the highest per capita income in the country. Not too long ago, the 1970s, the people of Flint had the highest per capita income in the country, and because of that, some of the best public health indices. But what followed in Flint was decades of inequality and injustice, driven by greed and racism and neglect. Plants closed, jobs were lost, poverty and violence became epidemic. And Flint really has been in crisis for decades. And Flint became a place, like so many in our country, where the zip code of birth, even more than your genetic code, is the greatest predictor of where you'll end up. Our kids in Flint, kids like Lily, will actually, their life expectancy is 15 years less than the life expectancy of a child in an adjacent neighboring zip code. And that's not right. And because of Flint's dire kind of financial state, in 2011, the former governor appointed an emergency manager, usurped democracy overnight to run the city. And the emergency manager's job was austerity, to save money, really no matter what the cost. And they decided that the water that we had been getting from the Great Lakes for half a century was too expensive for this poor, predominantly minority city, and that instead we would start drawing water from the local Flint River until a new pipeline to the Great Lakes was to be built. And it didn't seem right. Do you remember seeing these pictures? This is real. This is from a Flint home. Even when I first saw it, I'm like, this must be Photoshopped. Somebody must have put like iced tea through this faucet sink. This can't be right. It was real. And it turned out that the Flint River water wasn't being treated properly. And it was missing an important ingredient called corrosion control. And that made our water about 20 times more corrosive than the water that we were getting from the Great Lakes. And that brown, rusty color was because of iron corrosion. And it was so corrosive that within just a few months of being on this water, General Motors, which was born in Flint and still has plants in Flint, stopped using this water because it was corroding their engine parts. And they got a bypass to go back to the Great Lakes. Yet the people of Flint, the heroic and brave people of Flint who knew something was wrong, were told to relax, that everything was in compliance. And in the summer of 2015, a team of scientists led by Mark Edwards from Virginia Tech University, he was a scientist who helped uncover the DC lead and water crisis, came to Flint and worked hand in hand with the residents to conduct citizen sampling of our water. And they were telling us that Flint has a very serious lead and water problem. The water was so corrosive that it was leaching lead from our plumbing, and it was going into our drinking water. And there is lead in our plumbing because as a nation, we were stubbornly slow to restrict the use of lead in our plumbing. We didn't ban it from our service lines until 1986, and we didn't restrict it in our fixtures and faucets, in our brass fixtures and faucets until 2014. And to be honest, before all this, I never knew as a pediatrician that there could be the possibility of lead in water, and that's despite caring for hundreds of children with lead poisoning. Water was never on my differential, that long list of possible causes. It was always paint, soil, dust. And I didn't even know that the word lead means plumbing. So PB comes from the Latin plumbum, which means plumbing. And when the Romans built their aqueducts, they actually used lead plumbing. And the strong theories that hypothesize the demise of the Romans is because they used so much lead. And our pipes were so corroded that the folks at the EPA said it was like drinking through a lead-painted straw. And you never knew when a piece of that corroded lead scale was going to come off those pipes and into the drinking water and into the bodies of our children. And I want to share a little bit of lead and water levels. So the EPA, recognizing no safe level of lead, has a maximum contaminant level goal, which is not enforceable, of 0 parts per billion. The American Academy of Pediatrics recommends an action level for schools and childcare facilities at 1 parts per billion, but to date, there are no federal regulations that look at lead and water in schools. The FDA has a 5 part per billion standard for bottled water. The World Health Organization has an action level, which is also not health-based, at 10 parts per billion. The EPA's action level for a water system is set at 15 parts per billion, also not health-based and also not updated for quite some time. And in Flint, we had lead in waters in the hundreds and thousands of parts per billion. And the highest level that I saw was a home that had a lead level in their water of 22,000 parts per billion. And during this time, the summer of 2015, I was a busy pediatrician, a residency director, mom, wife, busy in my own busy bubble, a bit oblivious to what was happening in my city. And I was seeing patients who would ask me, is it okay for me to mix my baby's powdered formula with this water? And I'd be like, of course. Should I be bathing my child in this water? Yeah, why not? Are you sure I should drink more water instead of pop or juice? Yeah, sugar sweetened beverages, drink more water. Because how could our water not be okay? This is America, the richest country in the history of the world. This is the 21st century. It's not 19th century London with raging cholera epidemics. And this is Michigan. Where are my Michiganders in the audience? I know this one. All right, show me your hands. We're the mitten state. So we are literally surrounded by what? Water. We are surrounded by water, the Great Lakes, which is the largest source of fresh water in the world. 20% of the fresh water of the world is around Michigan. But despite all that, there's rules and there's regulations and there's people who wake up every day to make sure that when I turn on my tap, that the water is safe to drink. But that all changed when I heard about the possibility of lead in the water. And I thought about all my Flint kids like Lily, who are already struggling with every adversity possible, every toxic stress imaginable. And as a pediatrician, I know what lead does. Any pediatrician in public health freaks out when we hear the word lead. We respect the science that has got us to the point of no safe level of lead. And we also know that lead is a form of environmental injustice. It does not fall equally on all our nation's children. Kids in Flint already had higher lead levels, just like kids in Detroit and Chicago and Baltimore and Philadelphia. So I knew that if I was going to make any dent in the story that was already ongoing for a year and a half, that I would need the proof of impact in my pocket. I would need evidence that our children were in harm's way, that it was increasingly in their body. And as we heard earlier, we screen children for lead. We check their blood lead levels as part of routine visits at the age of 1 and 2. And I'm one doctor in one clinic. I can't tell you what's happening with a population. So we tried to get that surveillance data from local and state public health, and we're unsuccessful. And then we went to our electronic medical records. And it turned out that our hospital actually processed most of those lead levels in our community. and in record speed did that research, that detective work to see what was happening in the lead levels of our children. And contrary to everything that was happening at the national, state, and even city level, where lead levels have been coming down over the last few years, what we saw was that the percentage of children with elevated lead levels increased after the water switched. There was no change outside of our water limits. And in the areas where the water lead levels were the highest, we also saw the greatest increase in children's lead levels. And we also knew that this was an underestimation of exposure because many kids weren't screened during that time, and they weren't screened during the peak exposure of lead in water, which is a younger and more developmentally vulnerable age group. And then I did something that doctors and academics aren't really supposed to do. I walked out of my clinic and I stood up at a press conference before this research had been peer reviewed, which is a total academic no-no. But that takes a long time, and our children didn't have another day to spend. And I stood up with a team of growing supporters, although they kind of look like bodyguards, and shared that our children were in harm's way. And it took a while, but finally, our persistence, our teamwork, and our science spoke truth to power and helped expose this man-made crisis. And good things began to happen. The next day, the city declared a lead emergency. Within a few weeks, we switched back to Great Lakes treated water. The new mayor in December of that year declared a state of emergency for the city, which went up to the federal level. And in January of 2016, Obama approved that federal emergency, which enabled us to become a coordinated response, which also welcomed the CDC as part of our recovery. And our work was finally published in a peer-reviewed journal, the American Journal of Public Health, with some really cool maps with the support of a medical geographer that really allowed us to pinpoint children's blood lead levels where they lived in relationship to the water. The CDC also had access to the larger state surveillance data and published a report in MMWR validating these findings as well. To this date in Flint, we are still on filtered and bottled water as our damaged lead pipes are being replaced. But the city has rolled up its sleeves and we have built a model public health program to buffer the impact of this crisis. And I'm privileged to serve as a director of this Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative, where we are working in partnership with government, academia, philanthropy, nonprofits in a very community-informed, community-driven, community participatory way. In our initiative, we have two groups. One is a parent partner group where parents are at the table working hand in hand with us. And we also have a youth advisory council, and they just renamed themselves the Flint Kids Justice League, where kids are also telling us what we should be doing. Our work is grounded in science. Flint is a story of science denial. It was science that spoke truth to power, and our recovery is leaning on the incredible science, not only recognizing the science of lead's neurotoxicity, but leaning on the science of child development and toxic stress and early adversity and resilience in our recovery. We are treating this crisis as an added trauma on top of a population already rattled with so many traumas. We talked a lot about lead. We also had an outbreak of Legionnaire's disease. There was lots of skin issues, but really it was also a crisis of a loss of trust, of fear, of anger, of betrayal, of anxiety and guilt. And all those emotions in and of themselves can lead to poor outcomes. But there is hope, and our hope is in our secondary prevention programs, which have been evidence-based, resilience-building, development, promoting interventions that we have been able to put into place since the crisis. And those things include home visiting programs, breastfeeding support, high-quality childcare, Head Start, early Head Start, preschool, early literacy programs, Medicaid expansion, parenting support, nutrition support, mobile grocery stores, mindfulness, and the list goes on and on of the wraparound evidence-based programs that we have put into place to promote the development of our children. So it was about 150 years ago that Frederick Douglass said, "It's easier to build strong children than to repair broken men." And in a city used to building strong cars, we are now all focused on building strong kids. And Flint is learning from our lead disaster, and hoping to really turn it into a model of recovery, and hoping to be one of America's first lead-free cities. We are replacing our pipes this year. They will be done this year, and when that is done, we will only be the third city in the country that has replaced their lead service lines. We also have Medicaid CHIP dollars to do actual primary prevention, where people are inspecting homes and fixing up homes, abating homes, irrespective of a child's lead level. For too long, we have been using children and their blood lead levels as the detectors of environmental contamination. And this is where we need to be going in a truly primary prevention manner. We have HUD support dollars and a registry which is putting all this together, which I'll talk about more soon. But our work in Flint is very much beyond pipes. It's beyond people. We are working upstream with many different partners, both in health and outside of health, on the bigger things that all children and families need to be healthy. Things like economic development and living wage jobs and poverty mitigation and restorative and environmental justice and self-determination and participatory democracy. Flint is committed to not being defined by our crisis, but really by our response and our recovery. And the best part of this story has been all the positive ripple effects, especially when it comes to lead. Before the Flint water crisis, we thought we'd taken care of lead. Lead was a problem of yesterday. But Flint reminded the nation that it is a problem of yesterday, and it is a problem of today, and it is a problem of tomorrow. From East Chicago to Newark, people's eyes are opened to the ongoing risk of lead exposure to our nation's children. There's also an increased attention to drinking water safety, environmental justice issues, and children's health. And in a data-driven way, we hope to share all these ripples, to share our positive and proactive work, our best practices with communities everywhere. And we're hoping to do this in one way through our Flint Registry. So this is a CDC-supported project. It's a 4-year grant that allows us to identify those who are exposed to the crisis, most importantly, get them connected to the mitigating resources to promote their health and development, and to follow them over time. To date, this registry just launched less than a month ago, and to date, over 6,000 people have started that enrollment process into the registry. And I want to share the logo of this registry. It is the mythical African Sankofa bird. It was suggested by one of our parent partners at one of our community meetings. It is a bird that is flying forward, yet looking back and holding an egg in its mouth. And that is symbolic of all of our work, of pushing ahead, but never forgetting the past, and always prioritizing the children. And I want to end by bringing us back to Lily, grounding us in the why that we do all of our work. And Lily's most important lesson is that the story of Flint is not isolated. The legacy of lead lingers, and without bold investments and policies, we will continue to risk the tomorrows of generations of children. There are ongoing environmental injustices that disproportionately impact the poor and the brown. Deteriorating infrastructure is a public health issue. Flint is a story of what happens when we disrespect science and facts, and we see that ongoing with vaccine preventable outbreaks, our inaction on climate change. Lax regulations brought us the Flint water crisis. If we learn anything, it's the need to strengthen our regulations, especially when it comes to lead. We need to focus more on prevention rather than being crisis-driven. And then we need to focus more on children because, there's kids all over who are waking up to the same toxicities, Black, brown, white, rural, urban, that are waking up to the same issues of be it ongoing lead exposure or poverty or injustice or austerity or lost democracy. Despite all of this badness, I also want to share that we can learn a lot from Flint. Yes, the story of Flint is a story of a crime committed with absolute indifference against some of the most vulnerable people in our country. But it is also a story about how everyday people, moms and pastors and journalists and activists and scientists and doctors, resisted and said we've had enough and took action and built a model of recovery and hope. And this is the most important lesson from Lily. It is a prescription of hope, that we all stay grounded, awake, and alert, to people and problems and places that we choose not to see. That we all continue to ask questions, dig deep, and work together to each be a piece of the answer, not just for kids in Flint, but for kids everywhere. And I'd like to end by sharing a super quick story. So shortly after the crisis, a teacher from one of our toddler classrooms in Flint called me, and she said, the kids in my class made you something, and we want to bring it to clinic. I'm like, well, what did these toddlers, 2-year-olds, make me? She's like, they made you a water bottle chandelier. And I'm like, okay, we have a lot of water bottles in Flint. You know, people are dependent on water bottles and filtered water. I'm like, okay, you know, bring it over. I'm like, what could this be? And she brought me this. And it is gorgeous. And I was thinking about these toddlers making this. They were learning colors, following directions, using their fine motor and gross motor skills, making a mess with lead-free paint. But most importantly, they were just being kids. But they turned something that was a tragedy, our dependence on water bottles, into something absolutely beautiful. And this chandelier now hangs in our clinic, and whenever I see it, I smile, and it serves as an ongoing inspiration. But really, it serves as a mandate from our children that we have unfinished work to do. So they made another one recently for our Flint registry. This is that bird that I talked about. And you know, our Flint kids are unstoppable. They're very industrious. And they made another one for the CDC. So I would like to introduce Dr. Pat Bricey, Director of the NCEH and at ATSDR, and I would like to formally present him with this Flint-made, toddler-made water bottle chandelier. Thank you.
Thank you very much. As you're speaking, I couldn't help but think I wish they had a kids' Justice League when I was younger. That would have been really cool. But good afternoon. So I'm going to wrap up today by speaking to you about opportunities